Hello to all. My name is Dr. Christos Roukoudis. I'm one of the gynecologists here in IVF-Spain. I'm happy to welcome you all to our webinar for today with the title Infertility of Unknown Origin. We'll address this matter, and I will share with you my or our point of view to this topic, and like always, to answer in the end all of your questions. So feel free to write them down at our Q&A box, and in the end of the webinar, as always, I will answer all of them. Let's wait a minute so that everybody can log in. To all the new people that logged in just now, warm welcome. It's a very interesting topic, and a topic that could be the solution to the problems of many couples that struggle to get pregnant and are asking themselves, what's the reason for the lack of success? So let's start. Let's begin with the definition. Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. It can be primary or secondary, and primary infertility is when a pregnancy has never been achieved by a person, and secondary infertility is when at least one prior pregnancy has been achieved. Infertility affects millions of people of reproductive age worldwide and has an impact on the families and communities. Estimates suggest that between 48 million couples and 86 million individuals live with infertility globally. So in numbers, it means that it affects 15% of our couples. They struggle, they suffer from infertility, and the good news is that new diagnostic methods make it possible to find other causes of infertility that were former unknown. So a deeper investigation is possible. Now, let's say I have a patient in front of me, and or a couple, and seeks help to their struggle to their infertility. The first thing that I do is I evaluate the ovarian reserve. It means that I will start to evaluate how many follicles I can expect after a stimulation, let's say. This ovarian reserve, three key parameters are important for that. I will address them with the next slide. After that, I will control the ovulation to see if any abnormalities are there. We can also, it's necessary to test the function of the tubes to see if they are working properly. Let's say with a laparoscopy, with a hysterosalpingography, it's possible to look at it. Then the endometrium is also very important to see if in the lining any abnormalities are there. The semen of the partner is equally important and a proper investigation is necessary. And various other reasons are also very, very, very important. Unexplained infertility happens if all these mentioned parameters are normal. And our goal is to identify the cause and offer a personalized treatment, not to offer over and over again the same things. Very important is to know that in the female reproductive system, infertility may be caused by a range of abnormalities. As you see, in the ovaries, in the uterus, in the tubes, in the endocrine system, and others. And let's say tubal disorders like blocked tubes, which are in turn caused by untreated, for example, sexually transmitted infections or complications of unsafe abortion, sepsis after a pregnancy, after a delivery, or surgery can be a reason. About the uterine disorders, it could be inflammatory in nature, like endometriosis, congenital, like abnormalities in the anatomy, like uterus bicornis, for example, or fibroids can also be a reason. Disorders of the ovaries, as I said, like polycystic ovaries, and many other reasons. And our responsibility is to check all of them to see if any of those reasons are identified and is the, let's say, the culprit. Let's go back to the ovarian reserve. Let's say I have a couple in front of me and they ask for my help. First thing what I do, ovarian reserve, as I said before. The important things for that is the mother's age. The chances are different if a woman is 20 in comparison to a woman that is 40. The AMH. AMH, the anti-mullerian hormone, is signifies how many eggs are still in the ovaries, because it was produced by the granulosa cells inside of the eggs. And if this number is high, then I know there are plenty of eggs still inside of the ovaries. Under the follicle count, it means that that your gynecologist performs a scan on the first, second, third day of your cycle and tell you how many follicles are there. So these three factors are crucial to determine your ovarian reserve. First thing. Then anti-mullerian hormone. We know with advancing age, you observe in every woman that the oocytes becomes fewer and fewer. In fact, it is reflected in this AMH value as mentioned. Therefore, depending on the time, sorry, when the pursuit, when the pursuit of the desire to have children began, different constellations may be present. If the woman is around 40 and only then actively trying to conceive a child, it could be the case that there is a very low egg reserve. Therefore, except problem in the quality of the eggs, we have problems also in the quantity. More rarely, about 1% of all women may have a premature menopause. So it means that the ovarian reserve is diminished before the age of 40. So the AMH will be 0 in this case. You see it here very clear in the diagram that with increasing age, the egg quality and quantity drops. Also, with the age, we know that when a woman is, there was a big study came out 2012 or 13, 60,000 embryos got tested on day 5 of development, and that allowed us to draw some conclusions regarding the age in connection with the egg quality and quantity. So we know that when a woman is 20 years old, almost 70% of the potential embryos that she generates have the proper number of chromosomes that are haploid. When a woman is 35, 50%. When a woman is 40, 20%. When a woman is over 43, less than 10%. What does it mean? It means that if this couple, let's say a woman is 42, 43, they try naturally to conceive, the possibility that pregnancy will occur in a pregnancy, a normal pregnancy, it's quite low because the quality is not the best. Also, the amount of eggs are, the eggs are not enough. So there will be cycles where no ovulation will occur. There will be cycles where the egg quality is poor. So the fertilization will not be possible of the eggs. And let's say if it can also be the case that if the egg get fertilized, then the egg will not implant. So the result will be the same, no pregnancy, no implantation. So it will contribute to the general picture of this infertility. And also, we should also not forget that in some cases, this abnormal embryo has the potential to develop in a pregnancy and result to a baby with a chromosomal abnormality. One other known cause is endometriosis. It's very, very important to know because what is endometriosis? Let's start with the basics. Endometriosis is ectopic endometrial tissue. And so the lining inside of instead of being only inside of the uterus in the womb, it's on several, it can be in several spots. It can be in the peritoneum, in your belly, it can be on the intestinals, it can be everywhere, on the ovaries, and it can cause some issues. It's a very common disease. Around 40% of all the women have endometriosis, and endometriosis can be associated with symptoms and or infertility. It can reduce the vital reserve. It can be an obstacle, a hindrance for the follicle development. It reduces also the oocyte parity, and it can also has an effect on the tubes. So the tubes, I see it very often in the operating theater when I perform a laparoscopy, that they're immobile. They will not move like you would expect. And adhesions can also be a reason for those immobile tubes. Also, there's some women with a stage 1 endometriosis that doesn't cause any symptoms, but we know that this ectopic tissue can modulate the hormonic behavior and can, for some reason, affect implantation and affect also the egg quality. And so it's extremely important to do the diagnosis, to find out that you suffer under endometriosis and address this matter accordingly with medication or with surgery or with a stimulation. So, but it's extremely important to know that if you have endometriosis, and it's a shame that most of the women we find out that they suffer under endometriosis in an advanced age. Also, in the male reproductive system, infertility is commonly caused by problems in the ejection of semen, absence of low level of sperms, or abnormal shape, morphology, and movement, motility. It's very straightforward. 40% of fertility cases are due to a male factor. It's also important. We see very often that many colleagues, they don't pay as much attention as would be necessary, and they concentrate only on the female part, but that's not right. And the infertility may cause, in this case, by obstruction of the reproductive tract, causing dysfunctionalities in the injection of the semen. And this blockage can occur in the tubes that carry semen. And this blockage are commonly due to injuries or infections of the genital tract. Hormonal disorders leading to abnormalities in hormones produced by the glands, by the pituitary glands or the hypothalamus or the testicles, because we know that hormones such as testosterone regulates sperm production. And also many other reasons play an important role. It is very important to have a proper investigation. Also. We have regarding abnormalities, it can be the cause that we don't have any sperms. So it would be aspermia, azoospermia. It's a bit better. We have a little bit more. Oligospermia is even a bit better. And astenozoospermia, we have also a diminished volume. Teratospermia and necrospermia affects the morphology. So the thing is, we find out that some issues are there. The most important part is to have not only the diagnostic tools to find out, to diagnose them, but also to offer you an individualized treatment, and so to fulfill your wish to get parents. So first comes first, the new diagnostic tools. To them, very important is the receptivity of the endometrium. As I said before, all the time I have couples in front of me who have already a long journey behind them regarding attempts with IVF, with ICSI. What makes me personally very unhappy is that colleagues, after one or more failures, just continue to perform a new transfer without any new diagnostics and without questioning what was the reason for the lack of success. Individual diagnostics and to assign a reason is extremely important. For example, regarding the receptivity of the endometrium, the keyword is ERMA. ERMA is to find out when is the perfect time to transfer an embryo. I will go into the details in some slides later. Regarding the immunology, the keyword here is EMAP, to find out how your lining in your womb behaves from the immunological point of view. And genetics, a karyotype, for example, before starting stimulation is also very important, especially if you have tried some cycles before, to find out if any abnormalities in the chromosomes are there. And this could be also a reason why you produce, it could be a reason why abnormal oocytes or abnormal sperms get produced. So it's also important, and genetic testing and to find out the genetics in the embryo is also a very important step that I don't want to miss, especially after the age of 35 or after several unsuccessful attempts. Let's start with receptivity. The implantation is like a dialogue between the endometrium and the embryo, and it's very important to offer it to the couples if many unsuccessful cycles happened in the past. You see here, it's very straightforward. That's a female cycle. We have two parts: the follicular phase, for the first part, in which several follicles are recruited, but only one wins this race, and from which ovulation occur. During this phase, the growing follicle produces estrogen, which also causes the endometrium, the lining, to get thicker. And after ovulation, the corpus luteum forms get formed from the residual follicle and begins to produce progesterone, which causes also the endometrium to become more compact and vascular. Studies have shown that in about 70% of women after 5.5 days of progesterone production, the perfect conditions exist for potential embryo implantation. However, about 30% need 1 day less or more progesterone. This fact could mean that an embryo that is routinely transferred after 5.5 days will not implant. So with this test, this EDMAP test that we offer, we can find out if you belong to the 70% or the 30% group and do the embryo transfer according to the results. Now, one other important factor is the coagulation. For success, it's important to do a proper investigation. The blood clotting system can cause some harm. Microthrombosis, for example, could be the reason for miscarriages and falling implantation. And after several failed attempts, it's crucial that a diagnostic is performed to find out if any abnormalities exist and if a coagulation is during the stimulation or during the transfer necessary. For example, factor V mutation, heterozygote or homozygote could be one reason for falling implantation. Now, about the immunological part, our immune system is our friend and partner and help out to overcome, for example, infections. But also, there are cases where the immune system is overactive, especially about where our focus is in the lining of your uterus. We're capable to find out with a biopsy in the lining if it's the case and to treat it according to the results. There could be several abnormalities. There are some subgroups of our, let's say, of our immune police that is inside of the lining. If abnormalities there, we can treat it. Okay, so with the test that we offer, this EMAP, we have the diagnostic tools to find it out and to treat it. Other reasons can be Q-HLA constellation. What is it exactly? The Q-HLA constellation focus also to find out if let's say if the part of the embryo that belongs to the partner could be recognized as something something foreign from the maternal immune system, and as a result cause immune reaction. To prevent this, we do before investigation in the partner to see to which group he belongs. If it's the case and this constellation of the female and of the woman and the partner is not the best, we can address this matter also with medication. Thrombophilia diagnostic, as I said before, is also very, very important. What also is very important is, especially after many failed attempts, is PGT-A testing. The reason for that is that we can start that from the start we can observe abnormal embryos who, for example, are not able to result in a normal pregnancy. We categorize them in euploid, aneuploid, proper number of chromosomes or not. Those who don't have the proper amount of chromosomes, they will not be transferred. So the result would be that we will not have thoughts in mind why this embryo has not implant. The answer is very clear, because he didn't have the potential to do that. So you will not be in the infertility group, because we know from the start PGTA, we have tested the embryo. We have seen that the embryo was not normal, so it's logically that this embryo will not have the might, the power to implant. This is very important, and it's very important, especially for couples where this kind of diagnostic is forbidden. Okay, and let's say I have in many cases that with these stimulations we do after that a PGTA testing, and I see that let's say from the 6 embryos, only 5 are normal, have the normal amount of chromosomes. It means that, okay, from the start, I know I have at our disposal 1 or 2 embryos, the normal ones, and I will transfer only those kind of embryos, only the normal embryos. Let's say if this kind of diagnostic was not allowed, then I would start to transfer one embryo after another. So the result would be no implantation, and it would be, as I said before, in the category of infertility. So we can avoid it from the start. Then, coming back to the importance of the sperm diagnostic, I spoke before about the Karyotype constellation, Thrombophilia diagnostic. Then, as I said, a crucial diagnosis in the sperms is very, very important. Very often we see that besides a standard spermiogram, no further investigation was performed in the sperms, and so additional necessary treatment has been not performed. If we see here any signs of abnormalities, we do further investigation. We test the apoptosis, we test the fragmentation, the DNA fragmentation, and if it's the case, we have a protocol, we treat it according to the results. We offer also special selection techniques like capacitation is the important step in the maturation of the sperms. It is required to render them competent to fertilize an oocyte. Microfluidics techniques and ICSI is to select the best sperms for fertilization, and PICSI is basically a more filtered way of selecting the best competent sperm for fertilization process. Despite the fact that conventional sperm are selected for ICSI based on the morphology and motility, PICSI consents for this choice to be complete based on the sperm's capability to fertilize and perform their own job. Now, very important, initial consultation to determine the basis for a correct diagnosis. Extremely crucial. That's the first step. What I say also to my couples is that I need your medical history. Whatever you have from your former treatment, from the previous treatments, give it to me. I want to see them. I want to see what we can do better, what we can improve, and we learn from mistakes. Additional diagnostic tests, as I said, very crucial, very important to be capable to offer more things, to offer more, to have more diagnostic tools to find out things that for others would be something that they would not test it, but what gives us so a high success rate is to have the ability to find those things out and to offer a personalized treatment. Personalized treatment to treat it, not like you're not like all the women who struggles. You have it's your unique case, and so a unique diagnosis is very, very, very important. So with this, I came to the end. Here you see our centers in Europe, and our contact email address. If you have any further questions, feel free to contact us for a free consultation, and me or one of my colleagues will speak with you, and we will be happy to look into your files and give you for free our opinion about it, what we would perform in this case, and which things we would do maybe different. Also, if you have any other questions, you can also contact me directly on my Instagram account, Christos Roukoudis, and feel free if you have any questions. And you see also here on the bottom, we offer some free consultations on the 16th and 7th of July. So if you're interested, contact us. Now, let's answer some of your questions. Okay, I start with the first question. Hello, thank you so much for the time. I have a couple of questions. First, is a FSH of 9 too high, AMH 3 at 31? No, it's okay. FSH is not so important. FSH is highly bound to the phase of your cycle. AMH is cycle independent, and it's more important. AMH of 3 is a good value. Yeah, I will expect plenty of X. The second question is if you have some Thrombophilia mutations, can be a cause for infertility. Yes, it can be the cause. It can be the cause for factor 5 mutation following implantation is proven, and so it's also necessary that that we address it and treat it with heparin. Another question: do you do semen analysis to underlying possible variable cell? Yes, we do that. Mrs. K asked me, what can be done regarding poor eye quality, as we have done treatments before? We can do several things, but to give you precise, a very precise answer, I think the best is to contact us so that I can look into your case and tell you precise information, because it's also it has also to do with your age or maybe other reasons. So please contact us. Mrs. T asked, in spite of doing PGS testing of my embryo, still implantation failure has occurred. What could be the reason for the same? There could be several reasons. You saw during my presentation there are several things that we must address. I think the important thing would be endometrium diagnostic, also important would be to check if you suffer under endometriosis. There are a few things. In your case also, it would be interesting to see what my colleagues did before, what tests they have performed in the past. So I can tell you my opinion, what I would do different, or what additional test I would perform in your case. Okay, Mrs. M asked me, I'm 43 and a half, 43, of course, not 43 and a half, and have secondary infertility with one child, 10 years old. And now had series of miscarriages. Last one was September 20 at 10 weeks. It was referred to the recurrent miscarriage clinic and went through a series of test results, show that there was no known cause. In the case, what do as I'm scared of going through IVF and then have another repeat. Mrs. Sam, I understand very, very, very well your case. From the things that I see, most important, or better, or the most, because it's age related. Okay, we know that a huge, the main part of your embryos that you produce are not healthy. It comes because your eggs that you have the same age as you. The sperms, what I say over and over again, they come out of the fabric new, so they have a better quality in some cases. But the eggs, they're strongly, the quality of the eggs is strongly age related, and especially in your case, I saw that most of the miscarriages were before of the week 12. So most likely it's your miscarriages are because of the lack of quality. So I would suggest to you, okay, also to do all the necessary investigation, but PGT-A testing to the embryos, to test them, to see which of them are healthy, and after that to transfer only the healthy ones, because it could be the case that it will occur again, a miscarriage. I hope that I'm wrong, but it's because of the lack of quality. Mr. F asked me how to treat an incompatibility in the QIJ. We give you immune modulators. I give the immune modulators to your wife, so that your immune system will be a little bit not shut down, but it will allow the implantation. How successful is your process using donor egg? It's very successful because the donor eggs, they're coming from donors between 20 and 30, and so the age is not very important factor, because we know that those girls, those in this category, they will produce eggs with a normal pair of chromosomes. So it's extremely important, like extremely successful. But besides of that, as I said before, not only the egg quality is important, but also all the other reasons. So we must first do the proper investigation to have the best egg quality. It's an ace in our sleeve, but also we must find out that everything else is also okay. Especially if you had in your case many miscarriages. Is an AMH of 4.5 bad? Can you tell me it's in nanogram or it's in picomole? If it's nanogram, it's very good. If it's picomole, it's not good. what tests can be done if the embryo doesn't get to day 5? Investigation in the sperms is important to see if any problems with the sperms are there, and it's important. Any issues, and also I would try to support your stimulation cycle with additional medicaments. About the DNA fragmentation test, it's okay. Yes, it's okay. About how to treat a high cytokine ratio, what drugs will be used, are they safe? They're safe. Mainly we treat it with cortisone, but not only that. I need to see the whole report to give you a proper answer. Feel free to contact us through our email address or through or directly. You can contact me on Instagram. I live in the UK. Should I come to Spain separate for diagnostic testing before treatment with donor eggs, or can I have testing done in the UK? It depends. It depends. We have colleagues. They work in the UK, but for some tests, it's necessary for you to come to Spain. It depends on that. Question about if we are capable to improve mitochondrial damage in the egg. We will be capable in the next years, but to this point we need some further investigation as well. And if mitochondrial replacement therapy is available with your surgery, we don't do that. We do other, and I'm not a big fan of this kind of surgery because they're in the experimental and the pioneer field, and it's a process that takes very, very long, and the final result is unsure. I had couples, they collected eggs for 1 year, they did the surgery, and in the end it was a waste of time. If you don't have any further questions, it was a pleasure to present you this topic. All you can still write your questions down. We will do our best to answer all of them as soon as possible. And as I said, it was a pleasure to present you this topic. And I wish you nice rest of the day, and only the best. Bye bye.